Everybody, it's Lisa Salberg here with the Hypertrophic Cardiomyopathy Association, and we are going to start a new series today called Meet the Moderators. And on today's broadcast, we have Gordon Fox, who has been a long-term moderator, and excuse the headset and the phone, but we had some technical difficulties, and we're going to be using it that way today. So Gordon, why don't you say hi to everybody and tell them why we're here.
Hi, everybody. Why are we here? We're here so that you can meet me in the sense of finding something of a human being behind the posts and the name, and ask any questions that you like.
Wonderful. Okay, we're getting some people to join us here today. So we'll give a couple people time to join us, and I can say that I've known Gordon for probably almost 11 years now, and I think one of our first interactions was on the old HCMA message board.
Yes.
Which is still active, but due to the advent of things like Facebook, the message board didn't quite get the volume that it used to get. So why don't we talk about history a little bit and how you got involved with the message board community and what you use on it.
Well, it may help to say a little bit about my HCM. I was diagnosed with HCM 18 years ago, almost exactly, and I was only very mildly obstructed and not terribly symptomatic, and did just fine, just taking metoprolol for a number of years. And then I had a sort of dramatic experience. I was traveling, my wife and I were in Argentina, and I did a sort of dramatic series of faints in our hotel and wound up in the ER there. And it's a very long story. I won't bother everybody with much of it, but eventually they wound up doing an echo and saying, "Oh, you're really severely obstructed." My gradient was something like 130 at the time, and they told me to go home and said I probably needed surgery and didn't want to have it there, that I should have it in the States. And so I came home and went to my local cardiologist, who at first said, "No, you're not that obstructed. We just did an echo 6 months ago or so." And so he redid it and discovered that I was. And he said, "Oh, you need surgery. I don't know where to send you because I've never had anybody who needed this surgery before, but I'll ask around and you ask around." And we both did. And by the time he called me 3 days later with a list of several places that I should contact, I had discovered the HCMA on the web and spoken to you and come up with the identical list that my local cardiologist had. And off I went. I called Dr. Lever's office in Cleveland that day or the next day, and I was pretty astonished. I was explaining to Karen, his secretary, what had been going on with me, and she interrupted me and said, "I think he'll want to talk to you himself right away." And a couple of minutes later, he was on the phone and he asked me a few questions, and then he said, "Can you come up here in I forget what it was, a week, something like that?" And I said, "Sure, if you really think I should." And he said, "I really think you should." And I was up there and had a myectomy at the Cleveland Clinic, and it was all very fast and sudden and lots of drama. During my recovery, I started reading the board, the HCMA board, and I guess I had two different interests. One was that I wanted to give something back because I had, you had been a tremendous help to me. And the other was that I kept reading all these questions. Well, that I realized I had something to I can contribute to helping people understand some things. I'm a biologist, and I have lots of training in particular genetics and statistics, things that are relevant here. And I thought I could probably help people understand those things better. So I started throwing in my 2 cents worth to help answer questions about those things. And I don't remember when it was, maybe 6 months later, you asked me if I'd be a moderator. And here I am today.
So, Gordon, why don't you tell everybody what you do for a living fully?
I'm a biology professor at the University of South Florida in Tampa.
Okay. So here was this gentleman who had been through a change in his HCM status, a pretty quickly done myectomy, even though there had been like 7 years between your diagnosis and your myectomy, but it kind of changed very quickly. But there was something that I saw back then in the manner in which you educated people and you wrote that was really quite exquisite, and I thought could really help a lot of people, which is why I jumped in and said, you've been really good at this. And I guess I was right, because you've been doing it now for about a decade. Mm-hmm. And you've been helping, thousands of patients with HCM from literally around the world through first the message board community, which is still active at the core HCM site, which you can see below me here. Go to the forum space and you can read literally thousands and thousands of threads on people's experience with HCM. But as society changes and technology changes, Facebook has taken probably front line to the message board community. And we have the private group, which you can access through this page in the new group section. And you're also a moderator in that area. And do you want to talk a little bit about the differences between the way it was and the way that it is? It's different, I think.
It is different. I think the important difference is, well, the Facebook group has grown tremendously, really rapidly in the last year. And it's now, there's certainly more people active on the Facebook group than I recall ever being active at any one time on the old HCMA board. They are, one of the really cool things is that they're from everywhere. The HCMA discussion board was certainly not entirely Americans, but it was overwhelmingly Americans. And while the Facebook group is probably majority American, there's a tremendous amount of international participation. Lots of people from Australia and the UK and Canada, and where else? India, Philippines, a number, but still too small a number probably in mainland Europe. Yeah, lots of the world. And it's really quite impressive and quite exciting, I think.
What do you think are some of the benefits of participating in the private group?
Well, the benefits are that you get to participate in the discussion. You get to read the discussion. It's quite common that people read about others with similar experiences or similar symptoms. You get to find out that you're not alone, because it's extremely rare that anybody posts something that everyone else on the board says, "Oh, I've never heard of anything like that." Usually there are people who will say, "Oh yeah, I went through that," or "Sure, this sounds like this might be what's going on." I think that a tremendous amount of moral support, a certain amount of expertise. It's quite helpful, I think. I hope it is.
I think it is. I think we've proven that by being able to do this. We've been able to do this now for a long time, and we're moving along with technology. We're moving along with people's understanding of HCM. I mean, if I go back and I review some of the things that I originally posted in the forum, 12 years ago, 13 years ago, maybe even more than that now, we've learned so much.
Yes.
And things that we weren't sure about then, we now know for fact now. And we still don't know what we don't know, but we know this is evolving.
Yes.
And I think that's really incredibly helpful for everybody to understand. We're all learning together to a certain degree. We know a lot, we don't know it all, and we're all learning together. And believe it or not, some of these conversations that we get into on Facebook and these rare idiosyncrasies of the HCM community actually then get communicated back to our researchers and our healthcare providers so that we can actually help guide where research is going. So it's pretty intense, and I think we've all taken a part in that, but maybe not in a way that's been recorded in the medical literature and history as to where did these concepts and ideas come from. So I think that's kind of cool.
It's an interesting point, and I don't know if there is a way that could be done. It's worth thinking about.
Yeah, it definitely is. And that's the great part about this collaborative thinking. And we've all joined together to really discuss things at a level that most people will never have an opportunity to do in their neighborhood or in their own, clinic visit even, because we're bouncing things off of each other. There's a lot of information that I'd love to dig into more if we could get the researchers involved on hormone triggers in HCM, both in adolescent males and in older women. There's definitely some hormonal involvement in there that changes our disease state. Why? Who knows? But hopefully someday we'll figure that out. So while we have Gordon here on the line, and there's a number of people who've already joined us for the live presentation, if you have any questions that you'd like to go over with us as moderators at HCMA, we're happy to address those questions. You will be seeing a lot more of these interviews over the next couple of months and hopefully throughout the year. We're going to meet all the moderators from the board and from Facebook here, and we're going to be meeting doctors and healthcare professionals. And we put a call out for your own stories. So if you'd like to be interviewed by me and share your story of HCM with the world in this format, just send us an email to share my story at support@4hcm.org. I'll put that up in a minute. And we're happy to do these interviews. We'll be doing one tomorrow as well with a young man who survived a sudden cardiac arrest and went on to do some really amazing things. So let that be. So we'll let you populate your questions. Gordon, is there any particular moment in social media history within the HCMA that sticks out to you, or you think we made a big difference in somebody's life? Any thoughts there?
I know we have, because every so often, people that I was in discussions with 6 months or 5 years earlier sends me a note and thanks me for all the help that we were. In some cases, it's you helped me overcome my fear of having a myectomy, or I'm doing so much better now because now I understand this or that. How the the medicine works, or something of that nature. Moments where we sort of turned the corner. I sort of think that moment, that a big moment happened in the last year, just in the explosive growth of the participation on the Facebook board. And there's so many people now, and as I said, from all over the world participating, that it's just very different than it was several years ago.
I think so too. I think the ability that, we have moderators from different time zones around the earth. So yes. You're not normally going more than an hour or two without a moderator having the opportunity to review or somebody commenting back really quickly. So that immediate turnaround time, unlike the message board days where somebody could put a post in the morning and maybe a day later somebody might respond back to it, this is instantaneous. You're getting answers.
Yes.
So I think that's pretty amazing that we're able to do that in a volunteer type system.
Yes.
Everybody's just so wonderful about contributing. I think being part of this shift towards not just my own transplant, but more transplants happening, I think people getting very involved in the moments when our family members in the HCM community are going to transplant, and that energy around it, or when they're going off to surgery, that support that they're feeling at that moment. You watch the entire community come together and send their love and their support and their best wishes and support that individual in a way that I don't think we had a couple of years ago. Even if we had the message board group and you knew a few people, now it's not going it alone. You're going it with dozens and dozens or thousands of people who are there to support you in your effort. So I think that's kind of a cool thing.
I agree. And the other thing that I know, and I know you're aware of it, is that the specialists all feel a tremendous impact from this board. I know that when I saw Dr. Lever for my checkup in October, he commented on that, and as he has before, that he just said it's tremendous, not only the bump in the numbers of patients they see, but more importantly, in how well informed the patients are and how useful the questions are that they ask.
I think that's probably our biggest job. It's not to play doctor, if you will. We're there to help patients become their own best advocate. And that starts with knowing, what questions should I ask?
Yes.
And where should I start this process? So if we start to understand your anatomy and go from there, I think we get a lot further, a lot faster.
And I think it's amazing how ignorant we can feel when faced with the medical world. The first time I ever had to wear, I forget whether it was an event monitor or a Holter, the person who was giving it to me, explained how to put it on, and they said, and we want you to write down in here every time you have a symptom. And I said, like what? And they said, any symptom. And I said, what do you mean? They said, oh, any heart symptom. And, I was new at this. I said, what's a heart system? And this person really couldn't give me a good answer. They said, oh, it could be anything. And I sort of, rolled my eyes, thinking, well, it's not anything, surely you mean something more specific. And now I know, but it's very simple questions like that, for example, it's really easy for the healthcare professionals to be disconnected from patients. And it's a really useful role that we can play.
I think that's a really important point. I think we help patients connect with the healthcare community, and we also help the healthcare community connect with patients through other means that the HCMA does, such as our annual meetings or regional meetings, where we create this environment where patients can actually speak to these physicians out of the clinic and in a more social way, so that they understand us better. And I think that's really been a value of the organization, to break down those barriers between them and us. Yes. We're all in this together. And yes. The more we work together, the further we're going to go as a community. And that is in research and treatments and clinical trials. That's what we're all working towards together, so that we have better treatments for HCM. We have a couple of questions here. I've been popping some just general comments and hellos up. But now I'm going to post a question from Terry. Is it unusual not to be diagnosed with HCM until the age of 66? I'll jump in and say, no, it's not unusual. But however, if we had looked for it earlier, we probably would have found it. It just means you didn't come to clinical recognition or have a good enough echocardiogram early enough to identify that it was clinically visible.
I think that's right. I wasn't diagnosed until I was 47. And even though my first visit to the cardiologist, I really was skeptical that there was anything wrong with my heart. Once he gave me the diagnosis and told me to read up on it a bit, I realized, I've been having symptoms since at least my 20s. And, they all seem disconnected and isolated, but, sure. And so, when I was in my 20s, there wasn't such a thing as HCM. It hadn't been named yet. It had been, it had been named, but not HCM, and it wasn't well known. I think it's pretty common, actually, for people to be diagnosed at all ages.
The most common age of diagnosis for us statistically is about 40. But I've seen people not diagnosed until they're 80.
Yes. Yes.
And being 80 with HCM is not such a bad thing.
No.
So we can hope that more people are diagnosed later in life, but we're really trying to find those ones earlier. And we will do another whole interview about how to identify the unidentified at another date. But we got another note here from Justin, who wanted to let us know that the message boards were very helpful 6+ years ago before his septal myectomy and ICD. He was grateful to be referred there by his doctors at Barnes Jewish. So the ways people find this support mechanism is through Google searches and friend referrals, but also through physician referrals. The physicians understand the value of sharing your experience with like-minded patients and to get informed. We can tell the difference when somebody's sent for myectomy and they show up and they have the right questions and they're psychologically prepared for what's going to happen, and they have milestone moments because they've done a pre-myectomy call with the HCMA. They go in there, they're out a day and a half to 2 days earlier than the counterparts who never called or never got informed. So you get out of the hospital faster, you feel better faster, you know what to expect when you're communicating with other patients who've been there. And it's similar with, an ICD implant or just medicine changes, and even with transplant. So it's pretty cool.
Mm-hmm. That's actually remarkable. I didn't know that.
Yeah, we get in better, we get out faster, and we don't get thrown off kilter as easily because, you had a little episode of AFib while you're post-myectomy. It's an incredibly common experience, so don't panic. And if people know that these things are normal, they tend to take them a bit more in stride. And I'm really happy that we're able to help people get through that process. As part of membership into the HCMA, we give a call pre-myectomy, a week to 2 weeks before myectomy. We'll walk you through the whole process. I've stood in for surgery. I've literally been over Nick's Medeiros shoulder as he was doing the myectomy. So as much detail somebody wants, they can have. If they only want the highlights, we give them that story too, because not everybody wants the gory details. So that really helps people get through it. We do the same with ICDs and with transplant.
I think one of the really useful things is for people to be able to see a number of responses, because when I was getting ready for my myectomy, I posted something to that effect on the board, and a number of people posted very helpful things, which all amounted to, "Oh, you'll do great. It'll be fine. It's not a big deal. You'll be recovered pretty quickly." And that's true for some people. I had a lot of complications, and I had a hard time. In retrospect, it wasn't so bad. That is, by 6 or 7 weeks after surgery, I was doing pretty well. But that was a long 6 or 7 weeks for me, and it actually would have been helpful if there had been a larger community at the time, with which I could have read some people saying, "Oh, I was out in 4 days, and I did such and such after my." There was a guy, I'm sure you remember, Lisa, who was out in 4 days and went hiking on his way home. And I was out in 9 days, and I could barely shuffle when I got out. And it would have been helpful to just see some people say, "Oh, I had some trouble, and for me this was very painful, or I reacted badly to this drug," or something like that. And just be able to see that there's a range of responses, and nobody can predict what's going to happen to you.
And I think we all compensate in our own ways. And to hear from somebody that has a similar life experience to yourself, whether it be I had a little challenge post-myectomy, or I ran into this problem after my heart transplant, or whatever your circumstance was, we all have our own way of dealing with it. Some of us deal with it with humor, and some of us get very depressed, and some of us get very cavalier about the whole thing. But to see that there's not one right way to deal with whatever we're going through.
Yes.
To have that diversity, to have even the different ethnic responses to disease and management. you will get very different answers from somebody who's living in Asia versus Europe versus America about how we interact with the healthcare system and what questions are appropriate to ask and how to interact with our physicians. I find that fascinating personally, the differences in that regard. But to know that we're all in this together, although we're in our own little spaces in the world, it really is quite extraordinary what we've been able to build here, and one of the things that I'm really quite proud of. We have a comment here from Annie. Let's see if we can show that. It's kind of long, and I just went right over Gordon's face there with that one. Sorry about that. So she's saying that she was diagnosed in her 20s and had had symptoms her whole life. Shortness of breath was always a problem. She opened her mouth to compensate in her breathing, thumping in her ears, now elevated heart rate, hearing the pulse in the ears. And what they had to say when they were small, they said you had hearing problems. Oh, wow, that's interesting. I've never heard that before. So, Annie, when I woke up from my transplant, the first thing I said is it's really quiet. Because for the first time, I was 12 years old, I could hear my heart pounding in my ears. Not everybody experiences that kind of side effect of HCM, but I did, and I know exactly what you're talking about. And it took me a really long time to get used to the quiet. But I kind of like it now. Is what it is. Gordon, is there anything else we should know about you and your life and your hobbies or anything like that?
Me and my life and my hobbies.
I know you have some interesting ones.
I hope so. I'll say this, and people should take it with a grain of salt because it's my experience, and not everybody will have the same experience. But you know, I had a myectomy 11 years ago next month, and it's made a huge difference in my life. I am I certainly still have HCM. Still, in fact, I've got a doctor's appointment. I have to leave this conversation and go to a doctor's appointment. But you know, I am not much limited about the things I want to do. Having said that, there are things that I'd certainly like that some other people might like to do that I don't. You know, I don't want to climb Mount Everest, and probably shouldn't. Well, you know, last year I traveled a huge amount more. I travel a lot anyway, but I traveled more last year than I ever have before. I was in, I don't know, something like 9 countries in a year, on 3 continents. And, you know, I can do most of the things I want to do.
That's a good thing.
Yeah.
Doing the things you want to do is a good thing.
Yeah.
And Kevin Page just jumped in. Don't you travel a lot, Gordon? Yeah. Travels a lot. He takes very nice pictures.
I do travel a lot.
Okay, so Kaz has just put up a message here, and it's a long one, so I'm going to read that too, and then we'll wrap up here in just a moment. You joined in 2008. You joined the message board because you like to read how everybody had their surgery, and my doctor was doing nothing. Lisa personally asked for my echo, recommended being evaluated. I probably should have read this before I put it up, because I'm not as good at that story. Lisa personally asked for my echoes, and I went to Dr. Lever. He determined I needed a myectomy. Granted, led us multiple complications. The surgery was successful, and we thank me. Well, you are very welcome. I'm very happy that turned out well. Especially seeing as I put it up on Facebook for the world to see.
That's right.
So I'm glad about that. And Brenda had her myectomy 2 years ago, shortness of breath one way, but now it's back. So now we have to get back to square one and try to figure out why it's back. And then Janet, she's been around since 2003. Wow, that's a long time. The moderators helped you considerably with great information. I think they're all wonderful, and that's why I can't wait to share the opportunity of discussing with all of our different moderators from all over the place, you know, why they do what they do and their stories, because yes, I'm the founder of the organization. Yes, I'm the chief executive officer, and I'm the face that you see most of the time. But this is not a single person's efforts. There's so many people who are volunteering their time and energy to help make this organization run, as well as our fantastic staff. So I just want to make sure that through these Meet the Moderator opportunities, you can see some of this amazing intellect that we're able to tap into and have them share their experiences personally and some of their professional experience as well, because we have a phenomenal team of people here. So I'm going to let Gordon get off to his doctor's appointment now. Mary, one of our other moderators just popped in. Just to say hi.
And you know, I let me put you off for 1 second, Lisa.
Sure.
I had an opportunity. I was in Northern Europe this summer and had an opportunity. I thought, well, if I'm going to be around there, I got to see if I can visit with Marion, who I only knew from Facebook. And we had a wonderful time. My wife and I stayed with her and her husband and had a great time and really enjoyed interacting with them. And I think more people will find that people. Not everyone in the HCM community is going to be your best friend, but there are a lot of wonderful people.
I agree. Marion and I had the opportunity to meet for the first time in Italy and then here in the United States as well. So it is amazing the friends and camaraderie that you can find. And no, we're all not going to be each other's cup of tea as a personal friend, but I think we'll find that there's people out there that we can connect with on multiple levels. And we may have a connection through our hearts, but we might have other connections as well.
Sure, exactly.
All right, Gordon, thank you for your time today and for your diligence and your expertise and your time and commitment to the message board and to the Facebook group. I personally appreciate it, and I know the community does too.
It's my pleasure.
Great. Thank you all and have a great day.
Okay, bye-bye.